Hello there, David here. Welcome to the channel. Welcome back if you visited the channel before or if you're a subscriber. In today's video, I'm going to be talking about ulcerative colitis and Crohn's disease flare-ups, how to prevent them or how to treat them if you already have them. So hope you find this useful. I think it's very important how to treat or prevent flare-ups to keep the quality of your life a lot better. For those of you that are first-time visitors, my personal experience is that after 17 years of having ulcerative colitis, I was able to heal following an organic juice protocol along with some supplements. And you can obviously watch that video here in my channel. You should be seeing the thumbnail here, and you can watch obviously at any time after this video. First of all, I'm going to be talking about these four scenarios, four situations in which you may have a flare-up and how to prevent them and how to treat them if you already have them. Okay, the first one, because that happened to me the first after I healed from ulcerative colitis, the first one is going to be food poisoning. Okay, it sounds like too obvious, but in my case, about 2 months after healing following the cabbage juice protocol, I ate some stew, some meat dish that had a lot of broth, it was like a soup, and immediately the next day I started having a lot of diarrhea, eventually had a lot of headaches and like chills when you get into fever, and I figured it was this food that I had because I haven't had anything other than that recently outside of the house. Okay, the way I was able to heal from that is by switching my diet to a mostly liquid diet. I call it elemental diet, and you can find that also in my channel. That's one of the other videos. So I was having mostly shakes based on banana, almond milk, and some plant-based powder that I was using, having like 3 or 4 of those. And I stopped eating red meat and chicken because I figured those were a lot harder to digest. And since I eventually started having some bleeding again, that was forcing my gut to try to digest those foods and was giving me some bleeding. Not huge, but I knew I had to eat something easier to digest. So mostly the elemental diet, okay? And as far as meat, if I really had to, or plant-based foods, I was having some eggs, salmon, sardines, because these are a lot easier to digest if you're having some flare-up or need like a very easy to deal with type of diet. Okay, so my recommendation is stay away from eating outside of your house unless you really have to, especially during the last 3-4 months if you're in a healing process. Okay, so that was the first flare-up I had for about 2-3 weeks. Nothing huge, but I was a little concerned, but I was able to heal eventually following these advices. All right, the second reason you might want to be aware of that can give you a flare-up is if over time, this is different than the first condition I just mentioned, the first reason. If over time you keep eating foods that are overly processed, packaged, canned, in bottles, right? And they're overly processed, first of all, they have a lot of preservatives, they have a lot of additives to keep the food tasting good for a longer period of time. You may not see any flare-ups, any situations in the short term, but weeks, months down the road, that can weaken your immune system, which is what really causes the flare-ups. Okay, so I, from time to time, tend to do that. I try to eat as healthy as I can, but sometimes I would have soda here and there, some cookies, and as long as I don't do it on a regular basis, then I'm fine. But if you have a very unhealthy diet, down the road, as I said, you can have flare-ups because your immune system is going to weaken. So be aware. If you need to have a snack, something that you really have cravings for, have that, but don't make that your regular diet. So that is the second situation that you want to avoid they potentially can cause some flare-ups as well. All right, the third condition is similar to the second one in the sense that you're not going to see some flare-up immediately, but you can have it down the road, and that is a combination of lack of sleep, a lot of stress, and lack of exercise. Okay, we all have problems, you know, we all have to deal with financial situations, family issues, personal issues. So what you want to do is try to always get at least 6.5 hours of sleep. If you can have more, that's fine. Try to handle your stress by exercising. Okay, if you're gonna do some heavy exercise, try to have it or do it during the earlier part of the day. Better is not to do heavy exercise 3 hours before you go to bed, because otherwise your body's still going to be very stimulated and it's not going to be ready for sleeping. Okay, walking or some light exercise, it's okay to do it even before bed as long as it's light. So be aware of that. Try to always get enough sleep. Try to relax, you know, be praying, exercising, talking to people, whatever works for you. Okay, and that's going to keep your immune system strong. And fourth, last but not least, is the misuse of antibiotics. Very quickly, short story. Last year I had a tooth that was hurting pretty bad, and it wasn't time for my 6-month appointment yet. So my dentist recommended and prescribed penicillin. All right, so I ended up taking the penicillin. Actually, it's lower, or not slower, but smaller dose than what was recommended, because by the time I got the prescription, the pain already started going away. I can say though that at the end, towards the third day, the last day I took the prescription, the pills, my stomach did feel a little funny, like a little sensitive, like if something was being touched there. Okay, but no flare-ups. It just felt a little strange, like very sensitive. The issue was, a few months later, I was just laying down on the couch watching TV or taking a nap, and a spider stung me pretty badly on my right foot, my right hand. I only figured this out the next day or 2 days later, because the effect wasn't immediate. But I would say the next day after I got stung by the spider, I started feeling a lot of pain, you know, on my leg, on my right hand, and it started getting very swollen. You know, you could tell it was puffy, and I know it was a spider because in the past had something similar, so I kind of can tell the symptoms. So bad decision I made was to, first I took Tylenol and that didn't help. So my next step was to take the penicillin that I had left from months back. In my mind, I think it was because I was in so much pain, I was just trying whatever it would help. And I started taking a lot of penicillin, a lot of the antibiotics that I had left from before, and it didn't help. And what the antibiotic did, it kills your bad bacteria if you have any infection, but it also washes out and it kills any good bacteria. So basically cleans up your whole stomach, which is bad. You need to have good bacteria, good microbiome, because that prevents infections, that prevents flare-ups, because most of the immune system is in your gut. So I started having down the road, weeks and months, some skin issues like allergies, but it was more like a psoriasis. I'm good now, but I did have it for a while, and I did have some digestive issues, not very serious, but lingering. They just took a while to go away. So my advice is, do not take antibiotics unless it's prescribed by your doctor. Use it as recommended. You need to have good bacteria there for your proper functioning of your digestion, but also your immune system. So hopefully this is useful. You know, be aware of food poisoning, be aware of overly processed foods, take care of your stress, get good sleep, and for sure take care of being very, very careful with antibiotics. Okay, so I appreciate your support. Subscribe if you would like to get more content like this recommended to you, and thank you for the support again. I'll see you guys in the next video.